It's a very common belief that when we're suffering from back and leg pain, that is due to sciatica or a pinched nerve. But it turns out only about 1 in 10 or 10% of the time the pain in your leg is from the nerve or the disc, and it's much more likely to be referred from these joints in the back of your spine called facet joints. Hey everyone, this is Dr. Zach Redmond here, Performance Sport and Spine. In today's video, we'll be discussing lumbar facet syndrome, also known as fake sciatica. In this video, we'll talk about how to differentiate this from true sciatica. We'll talk about some postures and positions to minimize irritation of those joints. And then lastly, we'll show you the most effective and safe stretches and exercises to help resolve this permanently. Sciatica. The leg pain should be more severe or intense than the back pain. Your leg pain should go past your knee or towards your foot. You may also have muscle weakness, numbness, tingling, or pins and needles, and then nerve tension tests such as a straight leg raise or slump test should reproduce your pain. And then with lumbar facet syndrome, the leg pain and back pain are often equal or very much the same. The pain rarely goes past your knee and your leg. The pain is often dull and achy and kind of diffuse, and then some positions make it worse and some positions make it better, which we'll cover next. And then there's 5 different joints in your lumbar spine, L1 to L5. And if you look at this picture right here, it shows you that the different joints refer patterns to the different parts of your leg. So some will go in the front of the leg, and some can go to the buttocks or the back of the leg. Some positions that will make this worse and should be avoided temporarily are prolonged standing, arching backwards, sudden movements, and then returning from flexion. So think picking something up off the floor, and then as you stand up, it will often hurt. Positions and movements that will be helpful or decrease your pain are sitting, walking, laying on your back with your knees bent. Now I'm going to show you the 3 most effective stretches for this condition. So in a seated position with your legs bent, we're going to take our right hand and reach down to our left foot as far as comfortable, come back to the starting position, and then reach the opposite foot with your left hand. Again, you may want to start with a limited range of motion and make sure to relax your back and then increase that range of motion as you do it. One thing to know is when you sit up, you want to go only to neutral and you don't want to overarch because that will cause pain. So reach down and then stop even before neutral is better than going too far back. Second stretch is a rock back. So on your hands and legs, we're going to use our hands and press back and relax our back and press as far back onto our heels as we can. Kind of round the back up towards the ceiling, hold for a few seconds, and then come forward. As you do this, make sure you round your low back or your lumbar spine, not just your upper back. Sometimes squeezing your glutes can help, but you want to feel tension here, not on your upper back. Again, work on trying to relax into that position and not guarding the spine, and then press down with your arms for a little overpressure and get a nice tension on that low back. Stretch is the ball rollout. So in that same seated position with your exercise ball, we're going to use our hands to walk the ball out as far as we can and then come back. And this is great because it adds stretching, but also kind of teaches you to relax your back as you bend down and bend up. That will help to transition to the exercises that we show you next. And again, if you need to start going part way, that's fine, and then work on increasing your range of motion. But you want to make sure, again, that we're relaxing our low back and feeling tension there. And then as you sit up, only go to neutral, don't overarch backwards. The first exercise is the banded cat-cow. So we're going to take a light band over our low back, anchor it with our hands, and then we're going to round our low back up, squeezing our glutes, holding for a few seconds, and then coming back to neutral. And again, we want to emphasize the low back or the lumbar spine, so roll up, pressing your back as high up towards the ceiling as you can, squeeze the glutes, hold for a second, and then come back. Again, come back to neutral, don't overarch your back because that can load those facets. So again, round up, squeeze your glutes, hold, and then return to the starting position. This next exercise is probably my favorite because it's both a stretch and a strengthening exercise, and it helps us teach us to use our hips and our glutes and not our back. So what I want you to do is find a pole or a table or something stable. You're going to hold on to it with both hands, and you're going to squat down as low as you can. And again, the lower the better because it helps distract those facets and it's going to feel like a great stretch. But at this point, I want you to make sure to stand up using your thighs and your butt. You want to feel tension in your legs, not your back. So if you get down here and your butt starts to rise, that's using your back and that's going to hurt. So in this deep stretch, I want you to use your hands and pull up and practice using your thighs and your hips so we don't load those facets. And again, if you need to only go partway down to start and build the strength, that's fine. But again, your end goal over time is to get as low as you can, feel that amazing stretch, and then stand up using your legs, assisted with your arms. And then the last exercise, you're going to use a light kettlebell or weight or a bottle of water or a bag, and we're going to, in that seated position, holding this to our chest, we're going to practice rounding our back and bending our spine as far down to the floor as we can, and then sitting up straight and trying to condition our spine to use those muscles, but then again, not overextend your arch. So again, round your back, focusing on your lumbar spine or your low back as far as you can, and then sit up. To increase the difficulty, we're going to straighten our legs a little bit and bend forward as far as we can, and then again, return to the starting position. Unfortunately, the term sciatica is an umbrella term that gets misdiagnosed and overused a lot. And so hopefully this video gives you some clarification of whether you have true sciatica or lumbar facet syndrome, and then some effective stretches and exercises to resolve it. If you found this video helpful, please like it and subscribe to our channel, and then don't forget to check out our other videos.